is tweeting. He is at Michael C. Burgess. So you should follow him. Also follow Health Caucus. And you can follow me, A.E. Menefee. And you'll have to look up my last name. Fun spelling task for everybody. You know, one of the things that I think is interesting about this whole event, this event that we're watching unfold, is that we at Americans for Prosperity get accused of being all kinds of different things. And one of those is, you know, are you the lobbying arm of the health insurance industry? And people don't even stop to realize that the industry has not been on the side of patients so far in this debate. The healthcare industry has been here in Washington trying to make deals with the politicians, and that's a message that really resonates with people out in the States, that, you know, these guys are trying to protect whatever little corner of their own industry they possibly can. And of course we in Washington know that's not in their best interest ultimately, but that's what they've been trying to do. So I get questions from the media about that all the time. No, we are a patients movement. That's why our healthcare effort is called Patients First. And we're on the web at joinpatientsfirst.com. I'll give you a quick overview of some of the things we're doing and then talk a little bit about some of the messages that we found really resonate with people. First of all, we are doing grassroots events. We have about 75 events that are coming up in the next 8 weeks. And on joinpatientsfirst.com, we have an events calendar. You can check that. It's being updated almost daily with events being added. We're also working with a lot of other groups, including the Tea Party Patriots. This Friday, in fact, there's a big push to have Tea Party specifically focused on healthcare and to get people to their district offices of their senators and representatives to say we don't want any more government control over our healthcare. And I do say any more because I think we all agree we should have less government than we probably already have. And so, you know, as a couple people here have already mentioned, just because it's not a public plan, if it's not the quote-unquote public option that they've been talking about, there are a lot of other ways that they can increase government control, whether it's an exchange, a co-op, or by any other name. The rose will smell not as good. And so that's what our petition is also focused on, which is also at joinpatientsfirst.com. I checked it this morning. We have over 116,000 signatures so far, and the petition's only been up for a couple of weeks. So we're hoping to get far more than that. But I hope you'll share that with folks. And that's because this is a 501c4 effort, for those of you that means something to, that means it's aimed directly at the members of Congress and telling people, call your senators, call your representatives, and sign this petition that tells them, please don't increase the role of government in our health care, no matter what form that may take. In addition to our events, and people are getting very excited about the events, by the way. We had one over the weekend in St. Louis where there were about 500 people. So we're getting some really good attendance at these events. People are fired up. They don't want to see, you know, a healthcare industry bailout, which is one thing that we're talking about, having to keep doctors in business with our tax money after we get them on some kind of government reimbursement plan. And so people are very excited about this. We had one comment that a blogger noted from the St. Louis rally. He said, one person said, I've never seen anything like this. The current administration has only been in office a few months and people are protesting in the streets. So the Tea Party, you know, the Tea Parties were a big hit in April, and now people are really coming out for these Patients First events to show their support and really to learn more. I mean, people are getting a lot more engaged and involved, finding out what this means. As much as we can tell them, as Dr. Burgess noted, as much as we can find out about what they're actually trying to do to people, then we can pass that information along. We have doctors and nurses who have been speaking at these events. We have a good network of doctors who are trying to let people know how this could affect their health care and how this could affect them as patients, having access to their doctors on a very personal level, because this is such a personal issue. We also have TV ads. Some of you may have heard about this, read about this, or maybe even seen the ads. There's an ad that's been running for about 2 weeks, And if anyone's interested in all the states where it's running, I can give you that list afterwards, but I can tell you that they're very targeted. It's a very targeted effort to get people to call their senators in specific states. That's been in about 12 different states, and we have more ads that are to come. So we've just been getting started with that. And that's also having a big impact. Of course, the media are more interested in how much money we've spent so far than the content of the ad or how people are responding to that message. So at least I can tell you here, since I have the microphone, that the message is that we don't want a healthcare bailout, that we now own shares in the auto industry, the banking industry, that you and I are paying for, and we don't want to entrust our health to Washington as well. And like I said, we have more ads coming. We have an excellent one with a cancer survivor, an American that's going to be coming out very soon. And again, if you have questions about those, I can answer that in more detail. A few of the messages that I'm taking to radio, and if anyone has suggestions for that or for a message that you would like to get out, then I'm open to suggestions. Some of the things that I'm finding really resonate with people that are calling in and giving feedback. One of the primary things is exactly what Dr. Fleming was talking about, that members could possibly exempt themselves from whatever they decide is good for the rest of us. And that is a hugely resonating message right now. That makes people very angry. And another thing on the line of exemptions is, of course, Senator Baucus has wanted to exempt union members from a health benefits tax. I don't know how much ground the health benefits tax is still going to have, but of course that's an idea that people are none too fond of, having their benefits taxed. And then they're also very, very angry to think that union members could be exempt from that. And I believe there are some union members meeting with the president today, or meeting with some folks here in Washington today. So not sure exactly what the outcome of that meeting will be. But that is one message. Another is the president's broken promises. And Dr. Fleming also alluded to a couple of these. His promise that if you like what you have, you can keep it. I think that's been sufficiently disproven, yet he continues to repeat that promise. But we can, if anyone needs materials or info on how to tell people that that's not true, we can definitely help with that. Another broken promise that we see no way he can keep, he's already raised the cigarette tax, is to not raise any of your taxes if you make less than $250,000 a year. That was a campaign promise. I'm sure a lot of people were excited about voting for him, thinking that they were going to get a lot of tax cuts and not any tax increases. Now we have not only the health benefits tax, but the soda tax, the value-added tax that was floated, and other taxes that would hit people who are by no means wealthy. So that's another promise that a lot of people are very angry. They don't want to see their taxes go up, and they don't appreciate that being broken. Another thing that really resonates with people is that everyone's told them this whole point is to cover the uninsured. I like to tell them that without getting too wonky about it, that the CBO has told them, for Kennedy's bill at least, that after 10 years, if we implemented that plan, that after 10 years, 34 million people would still be uninsured. And that's just coming from the Congressional Budget Office. So when you tell people that, they say, well, what in the world are we spending $1 trillion or even $600 billion on? You know, it doesn't make any sense, and it really doesn't. What are we getting for that if the whole point is to cover the uninsured? I wanted to spend a moment as well on some of the things that we're for. I think we probably fall exactly in line with the Galen Institute on promoting things that are good for patients, things that put people as patients and consumers of healthcare in charge of their own care. And you know, a lot of people ask us, well, so do you think we don't need reform? Do you think things are fine as they are? And certainly not is the answer to that. In fact, we believe that we need more options, more expanded choices for patients. A lot of people have trouble with insurance companies. We know that, and we want to have a more open marketplace. There are a lot of ideas such as tax credits, buying across state lines, a lot of these different things that could really give people more competition, and that's the only thing that's going to bring costs down. As we've seen here on the Hill, they don't have any real ideas to bring our costs down. They're just trying to get the new cost of their bill down. And so these are some of the things that we support. ideas that we support, so people know that we are for some things. We're not only against everything. You know, I've been tweeting. If you see me on my BlackBerry, I'm not just checking email. I'm tweeting what's going on here. And I got a tweet from Jake Tapper of ABC News saying that the president apparently has said he's putting everybody on notice. We are going to get health care done this year. He got back from his trip and was, I guess, a little worried about how things are going on that effort. So that's the environment that we're in, and I'll be happy to take questions after. Thank you.